Good evening to everyone. Welcome to the webinar titled Ayurvedic View, Ayurvedic Alternatives to Allopathic Antibiotics. Today we have Dr. Subhas Chandra Dutta, Professor and HOD of Department of Shalyatantra, Jebira State Ayurvedic Medical College and Hospital, as our chief speaker. Uh, we are organizing this webinar through online mode, and we also have planned a series of lectures or webinars same like this one in future, and we will update you about this topic and other details in the official group that we have created. Dr. Subhas Chandra Dutta has a very good background, and he is also my teacher. I work under him for more than 1 years in surgery department, and I have seen him to treat patient and uh, surgical cases, complicated surgical cases, without using any modern so-called antibiotics, purely Ayurvedic drugs, and not Ayurvedic drugs, classical Ayurvedic drugs, not patent drugs, which are mentioned by our Samhitakar for a long time, and uh, uh, the result of the patient was very good, and sir also share his view today about his practice and experience. Now I would like to call sir to please start the presentation and tell us about your view and
Good evening, everybody. Good evening, everybody. I am Dr. S. C. Dutta from Kolkata. And first, I have joined in Goa Ayurvedic College, Gomantak Ayurved Mahavidyalaya in 2003. At that time, I have started working there. And after all, I have worked there for 6 years. And then after, I came back my hometown, Kolkata, and joined in the Government Ayurvedic College, which is named as Jebira State Ayurvedic Medical College and Hospital. And I am working there as a now as a professor, but I have joined as a lecturer in 2008. And after 16 years of experience, as Subhendu told, Subhendu basically insisted me to share my experience in surgical field. Basically, being a surgeon, what happens now? We think we don't have antibiotics, we don't have analgesics. So how we treat a surgical patients without the prescribing any modern medicines, modern antibiotics? So I searched for that for a long time, and I have experienced that the Ayurvedic medicines have too much potential as analgesic, antibiotics, whatever it may be. And what I have got after that, I am trying to share with you. I will complete the slideshow. Then mostly I will spend with you the question answer session. Whatever you have doubt, please ask me. I will try my best uh, to share my experience and clear any confusion there. First, if I show the what is antibiotics, all of we know, because all of we are doctors, so all of we know. Antibiotics basically the medicines, the molecules which basically kills the organisms which are detrimental to our health, but which affect our health. It may be virus, maybe bacteria, or maybe fungus. So antibiotics, though we know that antibacterial agents are popularly known as antibiotics, but antiviral agents, antifungal agents, antiseptics are also some sort of antibiotics. And in case of if we পরেরটা যাবো কি করে Ex- uh, 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 আচ্ছা ও হুম হ্যালো হ্যাঁ antibiotics basically antibiotics if we take the antibacterial agents antibiotics if I say antibiotics it is of two types. It is one is bactericidal and one is bacteriostatic. Which is bactericidal means it kills the germ, it kills the bacteria, and mostly the antibiotics are bactericidal means it affects its action but it does not kill the organism. And then another thing we have to consider that gram positive bacteria and gram negative bacteria. So these the idea, the broad spectrum antibiotics basically means to kill the gram positive bacteria as well as gram negative bacteria. And these are in use for the long time, Why antibiotics is so necessary? Because if you see the slide, you will see that global deaths attributable to antimicrobial resistance numbered 1.27 million in 2019. 2019. That means so many after so many antibiotics, we cannot resist a great toll of life by not controlling the infection. Then what I am telling that the next slide is global research and outcome. It is a very cumbersome work to develop a new antibiotic molecule. As I have showing you the slides, 40 years of vigorous research. The four types of antibiotics which are introduced for clinical use, one is daptomycin, one is tigecycline, one is linezolid, and fidaxomicin. After 40 years of rigorous research, it has been developed. And then, next slide. Then what happens? Uh, then what we see mostly after 2 or 3 years or 4 years, the resistance grows up to the antibiotics. So so many putting money, putting our labor, we develop after a long time. Suppose 10 years, it takes 10 years, almost about 10 years to develop a new molecule. But after few years, 2 3 years, after 2 to 3 years, it becomes resistant because organisms develop their resistance against these things. Then uh, how to resistance growth to antibiotics. Last I think 1 year before there is a শব্দ হচ্ছে না 1 year before it has been showed by the international scientists that um, organisms also can recall the molecule which affects their health, by affects their wall, affects their life, and so accordingly they mutate it to resist their potency. And the growth of resistance often occurs through vertical transmission of mutation during growth. And then what I am showing you, here again I am just recalling the thing. A new antibiotic often costs more than 1 billion US dollar, an equivalent of 10,000 crores in Indian rupees. Again I repeat, a new antibiotic often costs more than 1 billion USD, an equivalent to 10,000 crores of Indian rupees. and every year maximum one tenth of cost may gain after selling in the market, which means minimum 10 years needed to recover the development cost without interest. Then where is the profit? Why the multinational pharmaceutical companies will invest for new antibiotic development? Why they will do? So uh, this the gap, the huge gap of cost and profit ratio. So World Health Organization and other have warned governments about the scale of the expense coupled with growing threat of antimicrobial resistance. We put our labor, we put our money to develop an antibiotics, but within 2 3 years it becomes resistant to many organisms. So what happens now? The pharmaceutical companies are in hurry to sell it more of a new antibiotic molecule results early development of resistance. Early development of resistance. I have already told that time needed to develop new antibiotics as it is very expensive and often takes 10 years or more to develop. Each new formulation needs to go through rigorous testing for activity and patient safety. As we of know, many teachers are there, many PG students are there. The phase 1 to phase 4 study should be taken before coming into the market. Uh, তারপরে what happens now? Hurry ends in early resistance. As there is a, I have already told, as there is a huge gap of cost-profit ratio, so multinational pharmaceutical companies provoke their marketing division to make the doctors prescribe latest antibiotics even in controlling minor infections, which leads early resistance to the newly developed antibiotics molecule. Again, I repeat, they provoke doctors prescribing latest antibiotics even in controlling minor infections, which leads early resistance. And it is not good for anyone, not for the pharmaceutical company, not for the patient, and not for us. Now I just simply I am yeah, the facts that what is antiviral drugs? Antiviral drugs means which kills the virus, but why it is not so popular? The antiviral drugs are we can count in our hands, but antibiotics are so many. Why? That's because antibiotics affects the metabolic pathway of bacteria or virus, and that's why the bacteria or virus kills. But in case of bacteria, the metabolic pathway of bacteria and host cell are different, whereas the virus mutated its metabolic pathway as like as host cell. So antiviral agents cause most damage to the host cell. Always, always it causes most damage to the host cell. Host cell. So antiviral drugs are not so popular. Now, antibiotics. What antibiotics do? It control infections. So now we just simply we are looking after that. What are the common features of infection? Features of infection means redness, rubor, heat means calor, swelling means tumor, pain means dubor, and sometimes swollen lymph nodes. Sometimes swollen lymph nodes. Ah, then, if we if we if we if we search if we search medicine for infection, which rogadhikar we should go for? Which rogadhikar? As I have experienced and I have tried to find out medicines from jara, because if we turn our eyes to Ayurveda, the features of jaro and features of infection are more commonly same. In both, fever and body ache are predominant. Whatever it may be the cause of fever, like dengue, influenza, typhoid, various skin wound infections, systemic infection like pyemia, septicemia, all are rise of temperature is the main feature. Rise of temperature is the main feature. So always you have to find out the medicines to control infection. As far my knowledge, try to find out the medicines as antibiotics, but to control infection from Jaro Rogadhikar. Next, all of you know Ayurveda mentioned the six rasas: Madhur, Amla, Laban, Katu, Tikta, Kasai. But next slide. But among all those, only Tiktaras specify Krimi, Krishna, Visodosha, Kushtha, Murcha, Jara, Utkles, Daha, Kapha and Pitta. If we see the features of infection, Jara, there is a rise of temperature, there is Daha and Pitta means redness and so on, all are there. And another interesting thing I want to share with you that all of you know that diabetic patients are more prone to infections. And the interesting thing is Tiktaras specify diabetes also. All of you know all Tiktarasas are Prameho Nasok. All Tiktarasas are Prameho Nasok বা anti-diabetic বা oral hypoglycemics, whatever you think. তারপর যা Ayurvedic antibiotics. Ayurvedic antibiotics, all of we know that Ayurvedic medicines of herbal origin, which is known as Kastausadhi, and Ayurvedic medicines of mineral origin, which are known as Rasausadhi. কতদিন join আছে ডাক্তার? আচ্ছা ঠিক আছে না। Among Kastausadhi, all of we know that Guruji means Amrita, which is a herbs, which is Tiktarasa but Usnavirya, and which is preferable as Ayurvedic antibiotic. Ayurvedic antibiotic, Guruji, all of we know that Jaranasak. We also use Kamadudha. We also use Kamdudha, which is basically made of plain Kamdudha, not Kamdudha Mukti. What is Kamdudha? Kamdudha basically made of Amrita, Bulancha, Baguruchi. You may ask that the drugs which are Tiktaras, Sitavirja, may we use it as antibiotic? Why not? We also use it as antibiotic. The main example of that Tiktaras, Sitavirja, the medicine is Nimba. Nimba is very good antibiotics, but I prefer Nimba as a antiseptic preparation, not as a systemic antibiotics, not as a systemic antibiotics. তারপর দেখা then we will see the Rasausadhi described in Jaro Rogadhikar. One is Apurva Basanta Malati, number 2 is Subarna Basanta Malati, 3 is Hiranya Garbha Pattali, D is Chaturbhuj Ras, number 4 Chaturbhuj Ras. It is very good, very effective in case of upper respiratory tract infection. Very effective drug. As Lakshmi Vilas Chaturbhuj is very good drug to control any sort of lung infection. Then Kumar Kalyan. Kumar Kalyan specifically used for, all of we know Kumar means children, and it is also very good drug. Then Mahalakshmi Vilas, Makaradhaj. Makaradhaj is such a drug, it's a Rasayan, and it is used in Anupan Bhed. By Anupan Bhed, you use it from Atisar to cancer. Anywhere you can use Makarantha. It's a very, very good drug, very, very good drug. Then Mriganka, it's spelling mistake. Mriganka Ras is there. Mukta Panchamrit Ras is there. Visam Jarantak Lauha is there. Jayamangal is Jayamangal drug is there. Then there is a Troilokya Chintamani is there. Then Brihat Kasturi Bhairav there. There are so many drugs. Just simply I mentioned it to recall you that these medicines are there mentioned in Jara Rogadhikar. Now I am just simply I am differ from the IA non-biotics. What are non-biotics? Because as I have told that to develop a new antibiotics, it is very costly, very time consuming. That's why modern researcher they are trying to develop medicines which are known as non-biotics, means medicines already in use for different purpose but may have antibiotic property are known as non-biotics. Why they are searching for that, I have told that huge cost of new development of antibiotics leads to pharmaceutical companies quest for non-biotics. I am giving an example. Paracetamol, when we were 20 years before, when we are in early 30, it was used as antipyretic agents. बुखार कम करने का दवा था. Now it is used analgesic. It is mostly used now as analgesic, less as antipyretic. এক মিনিট, এটা আগেরটাই। Now I am asking a question that theoretically Tikta Rasa medicine described in Jara Rogadhikar is a very good antibiotics theoretically, but is it so? What do you think? What is your experience? I want to know. What I have told you have understood, no? Hello?
Yes,
Hello?
sir. Please repeat once more, sir.
What I am asking, no? Theoretically, I have told you that Tikta Rasa in which contains bitter in taste, and as well as the medicines as I have described you, the medicine described in Jara Rogadhikar may be used as Ayurvedic antibiotics. I am telling you, but theoretically it is true. But is it so? What do you think? What do you think? Hello. You can you hear me? Hello. Hello. Hello, Dr. Abadut, Dr. Devdat. Anyone? Dr. Roshan from Assam. Hello. Hello, Dr. Subhendu. Hello.
Yes, sir.
Can you hear me? No,
हाँ sir.
Yes,
but
sir.
no one is responding.
Yes, sir.
Audible.
Yes, sir.
What do you think? Is it true or not? What do you think? That will it work as a modern antibiotic or not?
Yes, sir. Theoretically, it should work and act as a antibiotic.
Okay. Just now I am showing little pictures to you. As you are seeing that this is a carbuncle, which are as Ayurvedic purpose, it is known as Prameho Pidaka. Prameho Pidaka. Okay. And before treatment, it was that type. There are देखो you can see that there are yellow colonization of infections, and after treatment it has been in that way, dry, without infection, and so on. Okay. Prameo is very difficult to control with, very difficult to control with, very difficult to control with medicines, antibiotics, very difficult. Broad spectrum antibiotics you should give, you should control diabetes first, and then so on, so on, so on. But this patient, my students, they who are joined here, my students working with me or in final year students, they know that this case has been treated only Ayurvedic medicines, and the result, you can see it. You can see it. Anti-diabetic agents means Diktarasa I have given, and mostly I use Rasausadi prefer. I prefer Rasausadi to prescribe. Prefer Rasausadi to prescribe. And then next one. আচ্ছা এটা ছাড়, এটা হ্যাঁ, এটা ছাড়, পরেরটা যা একদম লাস্টে যা। There, this one. This patient come to me. This patient come to me after doing operation in Chennai. I forgot, maybe Apollo, maybe anywhere, in a very good institute, because Bengalis almost go for south for their treatment. And after that, it has been operated, but they cannot heal the wound. They cannot heal the wound. He came to me with this wound, with secondary infection, burning sensation, sometimes fever, and so on, so on, so on. And repeated antibiotics he has taken, repeated antibiotics. He is a physiotherapist and he know everything. And after that he came to us, and you see, it has been healed properly, but only with Ayurvedic medicines. No other medicines has been given to him. Next one. Ja, Peria. This one. This one. It's a herpes zoster. It's a herpes zoster. This patient also a patient of hepatitis B. You see that. You see after 20 days you see, and after that you see this herpes zoster. We do not give in acyclovir. We don't have any complications of use of antiviral drugs. We with our medicines, I think in my website the prescription schedule is there. You may see that. And after that it is almost clear. And they who have encountered herpes zoster, all of we know that it is very much painful, having too much burning, and rapidly growing through the nerves. That's why it is very difficult to treat, and they takes at least 1.5 months or 2 months or 3 months to cure it. But we take, I think it takes 20 to 15 days, 20 days. It comes in that way, and after 20 days it has been cleared in that way. Very poor hygiene, and also suffering from hepatitis B. That's why I think little time has been taken. Otherwise, herpes zoster, what sort of herpes zoster it may be, if you come first hand to us, we can treat easily with Ayurvedic medicines only, and give you relief within 7 days. 3 days, maximum 7 days. Next. This one. This one, you see, it's a rheumatic ulcer. Rheumatic ulcer. This picture I have taken later on, because I am not so good in documentation. I am not so good in documentation. But after that, my students are there and they used to say that please sir, please take it. We should go for documentation of these things. And after that we have seen, okay, this is the case. No skin. It's a rheumatic case, specifically rheumatic ulcer. Swan neck deformity you are seeing in that case. Swan neck deformity is there. Okay, swan neck deformity. Okay, and after 14 years of dressing with betadine, means povidone iodine, no hope, nothing else. Sometimes maggot is there, sometimes maggot is not there, repeated antibiotics and so on, so on, so on. But it is as it is. No, no improvement. When they ask me to ask me at their home to see the patient, just simply they asked me, you can heal it? Though I have little confusion after that in both legs, this is also, I can show you that both legs, but it is little less and it is complete. They asked me, Jack, can you heal it, sir? Though I have confusion, but I have firm belief on Ayurveda. I have firm belief on Ayurveda, and I have told, no, no, I think it is possible. I think it is possible, and this is the this is the result. I think you can see it. This is the result. Suppose if you, this is wound means there is a infection. As there is infection, there is no question of growth of healthy granulation tissue, no growth of epithelialization, and so on, so on. But in course of time, repeated with repeated dressing, it has been done in that way. And my students, all my students, they who know me, they know what medicines, what tailam, what I have used for treating it. আচ্ছা তারপর এটা লাস্ট না তার আগেরটা ইয়া আহ, না এটা আচ্ছা হ্যাঁ yes you can see the report. Hello, Dr. Subhendu,
Yes, visible, sir.
visible no? The NS1, how much it is you are seeing?
0.98.
1.98. Dengue positive. Am I right? Point. If it is more than 0.8, then it is positive. If the date is, what is the date? Hello. You can see the date.
Sir, 18 November 2022.
Acha, 18 November 2022. Then first slide. Another slide. Huh. Here, point I think
2nd December 2022.
December to the means around 20 days. Am I right? And the
Around 14 days.
around 14 days. And then what I'm seeing that it is 0.51. I think so.
Normal.
Normal.
0.51.
It said means what I am telling, I am trying to tell you that dengue. Dengue means we get feared. What will happen? What will happen? What will happen? But dengue, within 14 days, it comes down. And I can show you the platelet count. Platelet count when it comes down to 85,000, 60,000, 70,000, it becomes treating with Ayurvedic medicines, not papaya juice. I am telling you again, I am telling you that not papaya juice, but with Ayurvedic medicines, it comes up to 1,60,000, 1,70,000 within 3 days, within 4 days, within 2 days. And as I have told you that why I have mentioned papaya leaf juice. Because throughout India, the pharmaceutical company told us, telling us, taught us that if there is a depletion of platelets, you go for it, and it will increase your platelet count. But what I will try to convince you that papaya rose, if you papaya leaf juice, if you taste it, it is so bitter in taste, so bitter in taste. That means bitter in taste, it can increase platelet counts. And I have used only amrita. I have not yet this here this slide, but I can a you I can share you with you that within 3-4 days it will increase. What it will increase. Then next slide. Next slide. Next slide. It next slide. Another thing I want to say, when there is infection in CBC or in total count, what we see that there is a increase of total blood count, which is normal range is 4,000 to 11,000. It becomes higher. It becomes higher, and you can see that the total count of WBC. Dr. Shobna Kamboj.
Yes.
Hello. Hello.
Sir.
Dr. हेलो.
हाँ सर.
डॉक्टर शोभना कंबोज है क्या? हेलो. हाँ डॉक्टर शुभेंदु. नो वन इज रेस्पॉन्डिंग.
सर.
हेलो.
हाँ सर.
हाँ हाँ
Oh,
मैं
yes, sir. Yes, sir.
what I am telling you, no, that what you can see na, the what is the total count here?
Sir.
How much?
3.8 million, sir.
28,000, I think
Two
600
total.
or
Oh, sir.
total count.
2,800, 200.
Uh,
28,200.
200. That means it's a huge infection is there.
Oh, sir.
And see the patient, the
Yes,
age of patient is I think 82 years. Okay,
yes, sir.
82 years.
Oh, yes, sir.
Am I right? And the
Yes.
date of report is uh, 3/3/2023, 3rd March 23. Okay, I am challenging you. You
Yes,
show anyone to your modern
yes,
counterparts, modern doctors, modern relatives, allopathic relatives, that a patient, a 82 years patient having a total count 28,200, they will go for meropenem, they will go for linezolid. Otherwise, they can't control it. Okay, I am challenging you. Anyone, I am challenging, and that next. Show the next slide. That one you are seeing, no? What is the total count now? What is the total count? 6,500. Am I right?
6,100.
6,500. And the age of the patient, age of the patient,
82 years.
82 years. The date of the this report,
9th March.
9th March. Okay, within 6 days. Within 6 days, it comes down to normal with Ayurvedic medicines only. What medicines I have given? Simply Subarna Basanta Malati. The patient party asked me that which was the main medicines for it. It is costly. It contains gold. I have told that this is the main drugs. So after 6 days, they have seen the great improvement, and I have not told to go for that after 5 or 6 days. They do it themselves, and they asked me that may we stop the Basanta Malati. That means they are astonished that these Ayurvedic medicines can work in such a way. In such a way. Okay. Then another slide I want to show you. Another this one, this you can see, no? You can see, no, these things. You can see.
Yes, sir.
You can see. What it has been written, একটু বড় করে দে তো বাবা, বড় করে দে, আমি পড়ে দিই। This is a Habiba Khatun, a patient on sorry, Habiba Khatun, Habiba Khatun, USG of whole abdomen on 2/4/2024. Liver is normal, spleen is normal, pancreas is normal, gallbladder multiple small calculi 2 to 3 millimeter, and question mark, maybe there is a gallbladder small polyp, and CBD dilated 13 mm with 2 calculus, means common bile duct contains also 2 calculus, one is 2, one is 3 mm each. ठीक है? And but it is non-obstructive type. As CBD is non-obstructive, so other symptoms are not there. That means white bile, hydrohepatitis, these are not there, and other things are normal. Okay, and it has been told that there is a stones, so it causes inflammation, infection, inflammation. So wall of CBD, common bile duct, shows chronic cholangitis, biliary tract inflammation. This was 2nd April 2024. প্রথমেরটা দেখা, just simply চলে গেল। Simply you see, this is the MRCP findings. It has been done on Calcutta National Medical College and Hospital on 24/1/2024. It is acute edematous pancreatitis, choledocholithiasis, means stones in common bile duct, dilated CBD, central bipolar HBR with abrupt distal tapering, possibly sequel of inflammatory stricture. इन्फ्लामेशन हुआ है, इन्फ्लामेशन होने का बाद स्ट्रिक्चर हो जाता है, जब सूख जाता है स्ट्रिक्चर हो जाता है, फाइब्रोसिस हो जाता है, ऐसा हुआ है। एंड focal T2 TFFS by hyperintense lesions with DWI hyperintensity involvement segment 7 of liver, evolving cholangitic microabscess है in liver, acute edematous pancreatitis है, and then I am showing that liver is normal, though no microabscess is there, spleen is normal, pancreas is normal, no pancreatitis.
Sir, presentation is not visible.
Hello?
Presentation is not changing. Please stop sharing and share again.
Hello? কি বললে বুঝলাম না।
আচ্ছা, প্রেজেন্টেশনটা বন্ধ করে আরেকবার শেয়ার করুন, দেখা যাচ্ছে না।
ও দেখা যাচ্ছে না, আচ্ছা
চেঞ্জ হচ্ছে না আর কি।
এখন দেখা যাচ্ছে? হ্যালো
জিবি ক্যালকুলাস স্লাইডটাই আছে, ওটাই।
এই যে জিবি এখন যেটা দেখাচ্ছি সেটা দেখতে পাচ্ছ না? এটা জেবি রায় করা।
না না না,
জেবি রায় পাচ্ছ দেখতে?
জেবি রয়ের, হ্যাঁ, ওই হাবিব
হ্যাঁ, হাবিবা
You
খাতুন।
know,
এটা 2রা এপ্রিলে করেছি।
খাতুন, হাবিবা খাতুন।
হ্যাঁ, হাবিবা খাতুন।
হ্যাঁ, হ্যাঁ,
তুমি
ওইটা
স্লাইডটা
দেখা
দেখছো তো?
ওইটা দেখা যাচ্ছে।
এটা দেখা
হ্যাঁ,
যাচ্ছে।
হ্যাঁ।
তার আগের স্লাইডটা আমি দেখাচ্ছি, যেটা ন্যাশনাল মেডিকেল কলেজে করেছিল।
ওটা দেখা যাচ্ছে না।
আমি দেখাচ্ছি আবার। ওখানে যাই, দাঁড়াও। দাঁড়াও, পেছনে পেছনে যা। এটা দেখতে পাচ্ছ এবারে?
হ্যাঁ, ঠিক আছে।
দেখতে পাচ্ছ তো?
হ্যাঁ, হ্যাঁ, দেখা
হ্যাঁ, আমি যেটা বলতে
যাচ্ছে।
চাইছি দেখো, এখানে ইমপ্রেশনটা
হ্যাঁ,
পড়ো,
হ্যাঁ।
নিচের ইমপ্রেশনটা। What I am telling, no, just see the simply impressions. Last one, acute edematous pancreatitis, and the fourth one, there is a cholangitis and micro abscess. But see, you see the next slide. কি রে, চেঞ্জ হচ্ছে না, দিকে যাচ্ছে না। হ্যাঁ, 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 here you see pancreas is normal. You can see it, no? Hello, you can see it.
Yes, sir.
You see, no, that pancreas is normal, means itis means inflammation means infection. It is normal now. And that liver is also normal, no abscess is there, and only with Ayurvedic medicines. নে তারপরে যা। this one না, তার আগেরটা দেখা। Here Sadikul is also there, and they believe in Ayurveda so much that his daughter, who is suffering from Plasmodium falciparum, not vivax, that means malignant malaria. She is suffering from malignant malaria. He asked me that, is there any medicines to control it, to treat it? I told her, yes, we had, and I have given medicines. And after that, it is, I think the date is কত দেখ করে ডেটটা দেখতে পাচ্ছিস কি? Hello, the date is, we can see the date of test.
Yes, sir. 2 to 23.
2/2/23. The next slide you see. Next slide. This one. This one is 23. The picture is not good. It has been cut, but 23, I think 3, after 1 month. The malaria parasite is not found. The fever which are coming off and on every day, each and every day, rise of temperature, and after taking Ayurvedic medicines, it gone, and now the malaria parasite has not been found in blood. আর একটা স্লাইড দেখা। কার্বঙ্কল গামা হয়ে গেছে, এটা হয়ে গেছে, এটা হয়ে গেছে, ডেঙ্গু হয়ে গেছে। হ্যালো, hello, almost I have completed my presentation, almost. Okay, no, just I want to share, what do you think after this presentation? What do you think? Is it helpful anyway? এইটার একটা, এইটা না, এটা তোকে শেয়ার করে দিলে এখানে ঢোকাতে পারবি? এটা গোটাটা ঢোকাতে হবে। হ্যাঁ, আমি ঢোকাতে তোকে পাঠিয়ে দিলে ওটা হবে নাকি? One second. What I am asking you, no, that what do you think after this presentation? হ্যালো, এখান থেকে বেরো তো বাবা, দেখতে পাচ্ছি না কাউকে।
You say this portion is not ready.
হ্যাঁ
You tell them this portion is not ready. Talk to them about these things
হ্যাঁ হ্যাঁ,
and
ওকে
they
ওকে,
will ready
হ্যাঁ।
for it.
হ্যালো, হ্যাঁ ডক্টর শুভেন্দু, হ্যালো।
Yes, sir.
What I'm doing, I'm just simply I am stopping my. I have already completed my presentation. I stopped to something. One thing I want to show them later on. Just I am introducing it, and before that I want to
Question answers.
question answer session. I want to start. Any confusion? Please ask me. Please ask me.
Okay, I request to all participants to ask any question if you have anything in your mind,
Doubts?
sir. Doubts, questions, patient-related questions
Uh,
in your practice, everything
yes,
you can
দেখা
ask, sir.
যাবে ওখানে?
Only the conversation is possible.
হ্যাঁ
Only the conversation is possible.
হ্যাঁ, কনভারসেশনটা দেখা আগে।
No PDF.
হ্যাঁ,
No PDF.
পিডিএফটা পরে পাঠিয়ে তোকে ওখানে
You
ঢোকাতে
can
হবে।
also ask the question in chat box. I will read it to sir and sir will try to give me answers.
Okay, you talk.
হ্যাঁ হ্যাঁ, হ্যালো।
So for the patient high leukocyte count, you have prescribed the drug Sparnamastimola. It is a single drug or it is
No,
having
no,
some
the
composition?
main drug is that because the patient when came to me, no, he he has urinary tract infection, stopped urination, burning, huge burning sensation, and a man of 82 years old, he does not want to go for nursing home. He does not go for any hospital for hospitalization. As as their other family members, they used to come for treatment to me. The patient means his son came to me and told, "Yeah, doctor, you can do anything for it, that we cannot admit him for hospital. We can prevent it." Well, okay, I'll do it. What I have prescribed, no, I am telling you simply. Bangesar, Punarnama Mandur, and Basantamalati. Simple three things. Always I used to tell my students that when you prescribe medicines, no, when you prescribe for any purpose, please, one medicine should be iron containing drugs. Dhatri Lauha, Saptamrit Lauha, Asak Lauha, Punarnava Mandur, Nabais Lauha, whatever it may be. But in a prescription, please, one medicine should be of iron. Okay. Huh, and it works. It works. Don't think that only Basanta Malati works. Everyone works. I am telling you. Doctor. What's your name, please? Hello.
Yes, sir.
Prabhu.
Yes,
Huh,
Tenmuri, sir. Tenmuri.
tell me, you are from?
Yes, sir. I am from Captain Srinivasa Murthy Ayurveda Research Institute,
Oh,
Chennai.
acha, Captain. Huh,
Yes, sir.
I went
Yes,
there.
sir.
I went there for a lecture. The CME program for teachers in pharmacology. I think that time there is a madam as a director.
Sir, yes, sir. Saraswati madam, maybe.
Saraswati madam, huh?
Yes,
I
yes,
know I know her, and she
yes.
as a resource person he asked me. I have shown my I have shown my training on Ayurvedic drugs, and then being a solo person, she invited me to deliver my lectures on drug delivery systems of Ayurveda, and I went there. I think around 2009 or 2010 at that time.
Okay, sir.
And the thing is that who came to receive me. I think at that time I 15 years younger. I think at that time I was 36, 37 years old. and he astonished that such a young person how can be a resource person. I remember. Okay, no. So every medicine works, every medicines. But why I am telling you Basanta Malati, no? Why I am telling Basanta Malati? Just simply I am telling you that all 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 sorts of patients when come to us, they have tried everything, then came to us. They when they complete everything, they then came to us. Okay, no?
Okay.
And just see, I one thing I want to show you. What I have told, I am telling, I am show you. Uh, एक minute, they're trying to, my daughter trying to insert it here. Uh, uh, हो गया? এটা अच्छा, you can see the reports.
Share करा नहीं, the screen is
Okay,
not
okay, okay,
shared.
okay, okay. Everything works. Suppose a patients continuously 10 years, 5 years, 6 years, they used to take pan D, pan 40. How you can treat those things, that those antral gastritis, with simply Sudhsakar, simply Kamsudha, simply Lilabilas? It is impossible. But if you prescribe Sudhsakar Gold, it works. It works fantastic. It works fantastic work. It does fantastic work. I am showing you.
Wait,
The,
one more minute, I need
one more minute. Okay, okay. Just we are trying to show you that how Guruchi Satta. Guruchi Satta means all of we know Gilay Satta, which is Gilay Satta. Uh, how it has been useful in increasing platelet count in a case of dengue. In a case of dengue. কোথায় দেখা যাচ্ছে? আমি তো কিছু দেখতে পাচ্ছি না। কোনটা? আগে চারটা পড়া।
Oh, chat Taco is not there.
হ্যাঁ?
Chat is not there.
That is not there.
No, just this thing is there.
Hello, Dr. Subhendu. Hello.
I'm trying to find it. It will take
अच्छा, can you see the ये?
the
Not
screen
visible,
is
na? Just simply to give me 2-3 minutes. I want to see something, show something. Okay, okay. Anything else? Till you can
about
ask
the
anything
reports.
else.
I'm adding
স্যার
it.
হ্যালো স্যার
Hello. হ্যাঁ
স্যার জ্বর জ্বর হচ্ছে স্যার পিত্ত প্রধান ত্রিদোষজ আর ইনফেকশনটাও হচ্ছে স্যার পিত্ত প্রধান।
হ্যাঁ।
তাহলে স্যার হিসেবে আমরা উষ্ণবীর্য আর উষ্ণবীর্য তিক্তরস সম্পন্ন ড্রাগটা কিভাবে কাজ করছে স্যার? মানে
উষ্ণবীর্য তিক্তদ্রব্য যখনই সে শীতবীর্য হয়ে যাচ্ছে না, যখনই সে না শীতবীর্য অলসো ওয়ার্কস। হোয়াট আই এম টেলিং নো, যে তিক্তরসা শীতবীর্য ড্রাগস অলসো ওয়ার্কস, as I have given example to you, that Nimba. But in case of you had told you that pitta means due to ushnabirjata pitta may increase. What you have told, that's so, no? But
হ্যাঁ স্যার, হ্যাঁ
ushnata can kill bacteria also. What I'm telling you, I've understood, no? Or Amrita is the one of the drug which can cold is Amrita, told is known is Amrita. It works everywhere. And that pitta, that means that one is Vidagdha pitta. Vidagdha pitta means pitta, the quality of pitta has been deteriorated. And if we give Sitabirja medicines, it works, no doubt it works, but I think it works less in case of Jara. But in that way we cannot say it, because suppose when there is a pitta jar, suppose in the month of August, in the month of September, we surely go for saribadi. Means sariba. Sariba means anantamul. Okay, saribadi is a tikta drabba. Sariba is a tikta drabba, but it is sitavirya. What I am telling you, understood? No. Suppose there is a sita jar,
হ্যাঁ
kapha jar, you should go for kapha. Okay, na? But when there is a Bataja jar, we should go for Hinguleswar. In that way, you have to think. Mean there are so many variety we have. We cannot we don't have any scarcity of medicines. We have huge choice. Anyone you can take and you give. Simply it will work, no doubt.
ওকে স্যার ওকে
Okay. চারটা পড়া যাচ্ছে?
It's not shared yet.
Oh, okay. It has not been shared yet. Okay. Anyone you can ask anything? Hello.
স্যার আরেকটা কোশ্চেন ছিল স্যার অ্যান্টিভাইরাল আর অ্যান্টিব্যাকটেরিয়াল স্যার দুটো তিক্ত রসের মাধ্যমে আমরা মানে সমন করতে পারছি, কিন্তু দুটো কি তাহলে স্যার আমরা একইভাবে ভাববো না আলাদাভাবে ভাববো?
না, আলাদাভাবে ভাববো। যখনই ভাইরাল হবে তখন অবশ্যই উষ্ণবীর্য দিয়ে ভাববে।
আর ব্যাকটেরিয়ার ক্ষেত্রে তাহলে শীতবীর্য দিয়ে ভাববো স্যার?
না, সেখানে উষ্ণবীর্য দিয়ে ভাববে, দরকার হলে শীতবীর্য ভাববে। No. In Bengali only. That what I am telling you, okay, that if a person having viral disease, viral infection, it will be better to go for tikta rasa ushnabirya drabba. In case of bacteria also, but in case of bacteria you may go for sitavirya a drug, sitavirya tikta drabba.
তিক্ত রস।
Sitavirya tikta ras you may go for also. It will work, no doubt it will work. But in case of virus,
Is the
viral
entire chart absolutely necessary?
eh?
Is the entire chart absolutely necessary?
Necessary hole they will get confident, no?
Okay.
They do not know me. They who know, if I
Okay,
don't show
like-
anything, they will believe. But they are participants almost from India. I am lucky enough that this is a short time of period, almost
স্যার ওটা হোয়াটসঅ্যাপ গ্রুপে দিয়ে দেন না।
হোয়াটসঅ্যাপ গ্রুপে দেবো, আগে দেখিয়ে দিই বেটা। হোয়াটসঅ্যাপ গ্রুপে দিয়ে দেবো।
Okay, I'm sharing it.
হ্যাঁ
You can talk about it.
হ্যাঁ আচ্ছা হ্যাঁ, you can read it now. Hello.
Yes sir.
I am Pranav Prakash, for my students final year. I have taken medicines for my mother regarding dengue. She is not having fever now, but her platelet is regarding. Now he has 60,000 platelet. What should I do further? Suggest me, please. Then I have told it has asked on 18th September. Okay, and on 10th p.m. Then in the morning I have told go for Gilay Satwa 500 milligram thrice with 2 drops of honey, and then call me. And he has told that there is a very much weakness. That's why I have told that Makaradhaj Bhati 2 times a day, Chalao 3 times a day, 2 times or 3 times. Oh, bola okay sir. Bola okay sir. Then after 20th September he has told me report.
You cannot speak without saying.
हाँ, तो on 20th September मैंने पूछा जो क्या हाल, तो उन्होंने बोला जो अभी बेटर है, आज रात में आएंगे रिपोर्ट तो सर आपको हम बताएंगे, इनफॉर्म करेंगे। तो देन এটা এটা তোল উঠবে কি করে?
It's in the next slide. Possibly.
হ্যাঁ he has, sir, on 20 September he has replied, sir, platelet count has spiked to 1.5 lakhs. Thank you so much, sir, for your cooperation. I have told that please circulate those people who used to go for antibiotics, platenja and fluid. Sure, sir. And this is the prescription of mine. I don't know, এটা বড় করে দেখা যাবে দেখো? হ্যাঁ আচ্ছা, you can read it, the prescription. Can you is it readable? Hello?
It's not readable.
No, sir. No, no.
No, okay, I will share you. I will share you further. Then you can see just simply what I am trying to understand. Huh?
Read the prescription.
I am reading from my WhatsApp chat 890.
Read your prescription.
890. What I have given: Sudarshan Ghanaboti, Dhatri Lauha, Mrityunjay Ras, Kamdudha, मंजिष्टदी कात और त्रिभुवन कीर्ति और मकरध्वज. But I have told that Tribhuvan Kirti and Makrodhwaj you will go for later on, because he will collect the medicines from our OPD, and he is from Bihar. He used to go to Bihar. That's why I have told him that you apply the 5 medicines first and take it, reserve the 2 medicines, Tribhuvan Kirti and Makrodhwaj Gold. And after that Makrodhwaj has been used and you see the result of him, of her. Okay, that means I have tried my best to control infections like Plasmodium falciparum with Ayurvedic medicine, antiviral agents, antivirus of dengue virus with antibiotics. I have shown you the sepsis of 28,200 with Ayurvedic medicines, and the ulcers, the secondary infection, the skin infection, I have shown you as far I have introduced here, and the infection has been controlled by Ayurvedic medicines. And one thing I want to share, I am doing surgery. I am doing surgery for around more than 20 years. In Kolkata, around 16 years. And firstly, I used to go for antibiotics, but I have a desire to stop it. How I have done it? How? First thing, when there is a cut injury, there are 2 or 3 stitches is to be done. Came to the OPD, came to the casualty, came to the hospital. We go for it. We stitches done, and then I am using Ayurvedic medicine, because they will, and they we ask for follow up after 3 days. After 3 days, we again go for dressing. And if I thought that if there is an infection continues, then we will go for antibiotics. If not so, then why we should go for antibiotics? And by astonishing me, there is no infection. It is completely dry. And after 5 days, 7 days, we off the stitches, and the wound is completely good. And then I build confidence on Ayurvedic medicines. And later on, after minor surgery, cyst, lipoma, ganglion, whatever it may be, when we remove it, we give stitches, and then we go for Ayurvedic medicines. And dressing with neem tel, guruchi tel, whatever it may be. We never use betadines. Even during painting before operation, during painting I use Triphala Quath for painting. No one told me that infection is there. And to dilate the anal canal, to dilate the rectum, mostly all over India, almost all over India, even in Ayurvedic hospitals, we use xylocaine. Xylocaine for dilatation as an anesthetic agent and as well as lubricant. But I use neem tel, guruchi tel for lubrication, for dilatation, and it is far more better than xylocaine. No way it is inferior than any sort of Ayurvedic lubricant. That much I want to say. Okay. But I am telling only, but you cannot share anything what you have thought, what you have understood, and so on. I think you will say something for me. Hello.
हेलो सर.
हाँ रोशन, डॉक्टर रोशन बोलिए.
सर गुड इवनिंग.
गुड इवनिंग, गुड इवनिंग.
सर ये वेरिकोस अल्सर में क्या यूज कर सकते हैं?
Varicosity, no. Varicosity, any sort of varicosity, any sort of vascular disease, any sort of. It may be aneurysm, it may be varicosity, it may be coronary artery thrombosis, coronary artery blockage. The only medicine is Giloy. Only medicine is Amrita. Only medicine is Dinospora cordifolia. The best medicine. What I used to give, Giloy Sapta, Kamdudha, Koisar Gukul, simply which are enriched with Guruji. Koisar Gukul, it is made of almost Guruji. Kamdudha, it is also most of Guruji. And Guruji Tel, from down to upwards, massage. It was very good. I can show
सिंपल
you.
कामदूधा रस ना सर, वो गोल्ड वाला?
नहीं, मुक्ता वाला नहीं. तुम
मुक्ता
सिंपल दो ना.
सिंपल वाला.
Simple. You can give simple.
Okay sir.
And from Nagaland, I think any participants is there from Nagaland. Is he there or not? Left. Hello.
I think she left, sir.
I think she left, no? And the Wolverine, Dr. Wolverine, are you from?
This is my another account, sir.
Oh, your another account, no? Anyone, anything to ask me? Otherwise, I will conclude my session.
স্যার বলছি ইউটিআইটাকে আমরা কিভাবে ভাবতে পারি স্যার? ইউটিআই যে ফিভারটা আছে, মানে সিভিয়ার ফিভারটা আছে স্যার.
UTI fever is a Tribanga, Bongo. Where is Bongo is there, no? You use Bongo containing drugs, Bongesor, whatever it may be. It controls infection. That UTI means urinary tract infection. It causes inflammation and it featured as Jara fever. Simple thing. And the medicines which are used in Mutra Bahasrot, you use it. It will work. Don't worry, you Bongesa, if infection is more, Brihad Bongesa, Tribanga, whatever it may be, Chandraprabha, and surely it will control.
আচ্ছা, তার মানে স্যার আপার রেসপিরেটরি ট্র্যাক্ট বা লোয়ার রেসপিরেটরি ট্র্যাক্ট ইনফেকশনের থেকে ইউটিআই যেটা হয় সেটা সম্পূর্ণ মানে স্রোত আলাদা বলে আলাদা ভাবে চিন্তা ভাবনাটা করতে হবে.
হ্যাঁ, করতে হবে. There are so many varieties, no? Same suit, not suit for everyone, no? Every person, there is different suit. In that way, the Desh Kal Patra, according to Desh Kal Patra, the medicine varies. The same disease, same prescription may not be if the disease in different places or different time. The Jara in September month and the Jara in March month, the prescription will differ. Always the prescription will differ.
Okay, sir.
Okay. And Dr.
Hello, sir.
Subhendu? Hello.
सर पोस्ट ऑप में एज ए एंटीबायोटिक क्या यूज कर सकते हैं सर?
पोस्ट इसमें पोस्ट ऑपरेटिव में तो मैं क्या देता हूं, मैं आपको बोलता हूं।
जी सर, जी सर।
हाँ, मैं आपको बोलता हूं जो एनोरेक्टल केस में हम क्या देते हैं। मैं थोड़ा आरोग्यवर्धनी का ये हूं। आरोग्यवर्धनी आई थिंक वन ऑफ द बेस्ट ड्रग इन एवरी सिस्टम, सो इट इज नोन एज
ओके सर।
आरोग्यवर्धनी। ओके, आरोग्यवर्धनी देता हूं, चंद्रप्रभा देता हूं,
जी।
चंद्रप्रभा देता हूं, अर्शक उठार देता हूं, और स्टूल सॉफ्टनर के लिए बोलिए बा अग्नि का वर्धन के लिए हम वैसनर देते हैं।
जी सर। सर ये सब
चलाते हैं।
पोस्ट ऑफ में देते हैं ना?
पोस्ट ऑफ में देते हैं।
सर ये सब ऑपरेशन के बाद देते हैं?
ऑपरेशन बाद देते हैं, ऑपरेशन का पहले भी जो देते हैं दवा, वो ऑल आर आयुर्वेदिक मेडिसिन। आई कैन शो यू द whole prescription of hospitals, because my house staffs are there, my students are there. They can confirm you, এটা একটু দেখ দিকে, এটা শেয়ার করা যায় নাকি দৌড়ে। এক সেকেন্ড। You have asked, no, I am so happy। এটা দেখতো বাবা একটু, এটা দেখ না, এটা তোকে শেয়ার করবো নাকি মেঘওয়ালা?
Is it a PDF?
হ্যাঁ, PDF।
I cannot. If PDF, I need to take a screenshot and then insert it. It will take at least 5 minutes.
Okay. I can show you a patient come to me
You cannot show them. You can
having diabetes with insulin. Dr. Tushar, with insulin, and
जी सर, जी सर।
after taking insulin, the blood sugar is 350, 280, 390, and so on. And so weak and so gastritis she had that if you put water on her mouth, no, he'll vomit it out. She will vomit it out. Okay. And the HbA1c 12.4. After 1 month, after 15 days, I have stopped insulin. I have stopped insulin and then with Ayurvedic medicines only, and after that it comes down around, I think after 2 months or 1.5 months, the HbA1c comes down to 7.1. 7.1, no insulin and no other medicines, only Ayurvedic medicines. I am sharing this because I am not so means I am no easy with these procedures. Okay, no. So I am sharing you simply in group. You see, and any questions you put in. I will explain you. So we think, so what do you think that they insulin dependent diabetes, we cannot cure it. We cure another thing, but we cannot control it. But we can do it. We can do it with confidence. You see that I have already shared. You see, and then you ask. I'll surely I'll answer. And Dr. Tushar, are you from? Hello.
Yes sir, yes sir।
Are you from? आप कहाँ से हैं?
I am from छत्तीसगढ़। I am from छत्तीसगढ़।
छत्तीसगढ़।
I am from छत्तीसगढ़।
अच्छा, okay। You see, no one will tell you that post-operatively, pre-operatively, don't go for Ayurvedic medicines. I am telling you, if you have any complications, please ask me. But please prescribe Shastriya medicines. Don't go for patent medicine. Patent medicines always have some adulteration. Always, whatever it may be. Okay, no? Okay.
Sir,
anyone?
can you repeat sir medicine? Hello?
Medicine, no? Chandraprabha, Araggavardhani, Arsakutar, Vaisana.
Okay, sir.
Sometimes Rasamanikka. Skin infection is there, no? So always prefer Rasamanikka. Horital containing drugs. Horital containing drugs very much useful in skin infection, skin disorders. You can see कुष्ठ रोगाधिकार में जितना दवा है, whatever medicine prescribed, whatever it medicine, all contain saritol, all containing monocylla. If we go for jara rogadhika, almost every medicines have Vatsanav. If we go for diabetes, almost every medicine have Shilajit. In that way, you have to think, and we have to go for, we should choose medicine for different conditions of the disease and different disease also. Anything else?
Okay, sir. Thank you, sir.
Okay, welcome.
স্যার আরেকটা কোশ্চেন ছিল স্যার, বলছি ইউরিয়া ক্রিয়েটিনিন স্যার সহজে তো আমরা মানে মডার্ন মেডিসিন অনেক সময় ফেল করে যাই।
ইউরিয়া ক্রিয়েটিন তোমাকে আমি দেখাবো। I will show you with Ayurvedic medicines, with Rasaushadhi, we can down creatinine, urea, both. I will show you in the next lecture, or if I can continue it. I think in different disease I will show. Otherwise, there is vast thing is there, and the topic we will share it, and then again we will share. We will go for this webinar.
ওকে স্যার। স্যার আরেকটা বললেন যে স্যার সেপ্টেম্বরের জ্বরটা আর মার্চের জ্বরটা, স্যার একটা তো সেপ্টেম্বর মানে স্যার শীতে হচ্ছে, আর মার্চে তো স্যার মোটামুটি গরম একটা গ্রীষ্মের ব্যাপার।
সেপ্টেম্বর মানে পিত্তজ জ্বর। সেপ্টেম্বর মানে হচ্ছে শরতের শেষ, শরতে কার প্রকোপ হয়? পিত্ত।
হ্যাঁ পিত্ত স্যার।
পিত্ত। আর মার্চে কফের প্রকোপ
কফের প্রকোপ হচ্ছে। হ্যাঁ।
তো ওখানে কফেজ জ্বরের চিকিৎসা করতে হবে, এখানে পিত্তজ জ্বরের, এই হচ্ছে কথা। We have to treat fever in March as a কফজ জ্বর. We have to treat fever in September as a পিত্তজ জ্বর, and fever in July বাতজ জ্বর।
স্যার অ্যাকর্ডিং টু সিজন যে স্যার পিত্তজয়ী জ্বর হবে এটা তো কোনো মানে নেই স্যার, অন্য দোষেরও তো জ্বর হতে পারে।
But you have to see it. But first you think grossly, then অংশাংশু কল্পনা।
ওকে স্যার।
But পিত্তজ কাল, in case of পিত্তজ কাল, পিত্ত প্রকোপ কাল, mostly the fevers will be পিত্তজ। Variation may be there, but it is little variation. Don't think for variation. What I am telling, every practitioners I want to tell, then don't go for psoriasis. That I can treat psoriasis. How many psoriasis patients we have? But if you go for tinea, no. If you go for tinea, everyone has tinea. You cannot complete your OPD if you can control tinea.
Sir, drug of choice. Sir, drug of choice.
In which case?
Sir, পিত্তজ, বাতজ, কফজ।
ও জ্বরের কথা পরে বলবো, এখন এই অ্যান্টিবায়োটিক্স থাক। এতটা বুঝেছো তো? লম্বা লেকচার শেষ হবে না তাহলে।
থ্যাংক ইউ স্যার, থ্যাংক ইউ, থ্যাংক ইউ।
Anyone else? Anything to ask? Hello? Anything to ask? So Dr. Maiti, we may conclude now. Okay. Okay. Good night. Good night to everyone. Bye.
Good night, sir.
Good night.